Hi, I'm Dr. Ron Miller of Pursuit Physical Therapy, and today we're answering the question, why does sitting in a car cause lower back pain? So there's three main causes with this. The first thing is quite simple. It's your seat parameters. Nowadays, you can actually adjust the amount of tilt you have. You can tilt the whole seat back and forward, and you can adjust this part too, okay? So if you're noticing that when you're sitting in your car, you're getting or experiencing low back pain, the first step is try to adjust your seat parameters to see if it can decrease or even increase your lower back pain. If you find something that increases it, do the opposite and try to go into the direction of where it doesn't cause pain. Okay, but try to adjust the seat and see if you can adjust it a certain way that you can decrease your back pain ultimately and be able to drive without causing your lower back symptoms. A lot of times also, if you're sitting in one of those old kind of bucket seats, it kind of compresses you and pushes everything in, and you're in a flex position, so then it aggravates that. Unfortunately, that's hard to do. You may have to buy a McKenzie roll or some sort of object to help support you in that type of thing, because you're not going to be able to change those old bucket seats. The second thing is very common to have right-sided back pain when you're sitting in a car. And this is normally due to a disc problem. Either you're an active individual, you maybe aggravated your back going into flexion, doing a deadlift or a squat or lifting something, and you may be a bigger or a taller person and you're sitting into a smaller sports car like an Audi or any kind of sports car, and you're in a lower flex position. A lot of times sitting in a car in a flexed position is going to put pressure on that disc. And you don't necessarily have to have a herniated disc. It could just be discogenic symptoms. And that sitting in that flexed position, especially using your right foot to go from the brake to the accelerator and back and forth, you just compress that right side in that flex position. So normally in that case, you'll probably need some sort of treatment, whether it's physical therapy interventions, addressing that and trying to restore full lumbar extension and centralizing any type of pain. In this case, if you do have discogenic symptoms, you may even get some glute and buttock and leg pain going down that right leg also, the longer that you do sit. The third thing is actually more of an SI joint problem, where you'll notice like right-sided back pain, but it doesn't shoot down the leg. It actually curves around the hip and almost goes into the groin. And that's actually a hip flexor or an SI joint problem, because the process of you flexing the hip and activating that hip flexor from going to the brake to the accelerator in a flex position is just activating that hip flexor or the iliopsoas muscle, and then you're experiencing this right-sided back pain. Again, this case is easily fixable also, but it's very common in sports cars where you're having a bigger individual who's taller in that crammed flex position, and normally it's a case of unilateral back pain and stuff like that. So if you liked this video, if you found it informative, please share it on social media. But we went over the three main causes of why you may be experiencing low back pain while you're sitting and driving in your car. If you are experiencing back pain and it's not going away, please give us a call. We'll get you in for a thorough evaluation and we'll solve the problem of what's really causing your back pain. I'd like to thank you very much for your time, and if you have any questions, please visit us at pursuittherapy.com. Thank you.